Hello, Vanakkam. This is Dr. Vijaiyalakshimi Praveen, MBBS MD. I'm a public health specialist. The purpose I'm making this video is that I want us to stop spreading the hoax about the infection dengue or dengue. So I'll list out the myth and I'll also tell you why they are untrue. The first one is that dengue infection or dengue fever is a new infection and that it is an unknown infection. It is not true because it's been around for at least 2 centuries now. And this infection has been extensively studied and it is very easily diagnosed by doing blood tests from the laboratories around us. The second one is that the confusion that prevails between viral infection, viral fever and dengue fever. The fact here is that dengue fever is very much a type of viral fever and this virus spreads from an infected mosquito to human beings when the mosquito bites a human being. The third one is that a person who is infected with dengue virus is going to die eventually. This is again untrue. It is only the severe form of dengue, which is dengue hemorrhagic fever, which is potentially fatal. And the risk of dengue hemorrhagic fever is high among kids, children, newborn babies, pregnant mothers and also elderly. The fourth one is that a person who is affected with dengue infection will die of hemorrhage or bleeding because of the evil spirit or evil eye that he has possessed. This is again untrue. Evil mannerism, which is lack of knowledge and ignorance, that it is the pile of garbage around our houses and streets which is a major source of breeding for mosquitoes, and this along with the stagnant rainwater, stagnant sewage water, and it even could be the pots which we are using for collecting drinking water and bathing water that are kept uncovered. And the fifth myth is that a person who is infected with dengue will die of high fever. The dengue fever doesn't reach very high temperatures. It reaches moderately high temperature and then it gets better. But what happens here is that after 48 hours or 2 days post fever, the virus starts affecting the platelets. It is a kind of blood cell which helps blood coagulate or clot. So since this virus affects the platelets and the platelets count starts coming down, the blood loses its tendency to get clotted and hence it leads to hemorrhage or the loss of blood. So here, more than the loss of blood, there also happens loss of fluid. This fluid is in the cells, which is inside the cell, which we call it intracellular fluid, and there is also fluid around the cell which we call it extracellular fluid. So the hemorrhage, which is blood loss, along with intracellular and extracellular fluid loss are the major cause of death in case of dengue hemorrhagic fever. So the last myth is that since the platelets gets affected, only a blood transfusion can save the life of a person who is infected with dengue. Negative. This is untrue because more than hemorrhage, as I told you, since the fluid loss leads to death of the person who is affected, the major mode of treatment to save a life of a patient or a person who is infected is just hydration, simple hydration. Hydration typically means intake of fluids. What kind of fluid? It could be any fluid. It could be a fluid, liquid food or a juice or just plain water. How much do we drink? There is no quantity as such because the person should and can drink as much of fluid or water as possible. So what I request all of you is that please stop spreading the hoax and please get yourself hydrated or hydrate the person, your loved ones who are affected with dengue or even people who are not being diagnosed but has symptoms of dengue or dengue hemorrhagic fever has symptoms like rashes, like red dots on the skin. They might have abdominal pain, they will have frequent vomiting, they'll also have respiratory distress. So the moment you find your loved one with such symptoms, please take him to a physician, also known as a doctor, who is close by, and please act accordingly. And your lives is in your hands. Please save yourselves, please get yourself hydrated and please stay healthy. Nandri, Vanakkam.